What's happening, Delco? I'm Rich Shane, and welcome to the What's Happening Delco podcast. Today, I'm joined by Laura Maleknia of Discover Optimal Healthcare. Laura, welcome to the podcast.
Thank you so much. It's really an honor to be here.
Well, thank you for honoring us with your presence. So we're both honored. How's that? So, Laura, what do you do?
Well, I'm a nurse practitioner. I'm new to Discover Optimal. I got my nursing degree from NYU and my master's from GW, and I just came here from Penn Internal Medicine, and I couldn't be happier about the switch.
Wow, you have a great resume, or you have a great list of places that you've studied and have been educated.
Yeah, it was a long road to get here, but I'm here. So, yeah.
So what can people expect when they come to you? What services can they expect that they will be working with?
Well, the first thing is that we're a regenerative medicine practice. So we have our chiropractors. We just welcomed Dr. Murray Claire to our practice. And obviously Dr. Jason this is his practice. So he's was the main chiro, and he's been doing this for many, many years, and he's phenomenal. So patients can expect kind of a model that helps them look and feel their best. So we offer chiropractic care. We offer orthopedic care. So anyone with joint pain, muscle pain, we offer trigger point injections, also injections into the joints. And I can go into that a little bit specifically because some of those injections are really cool and set us apart. We also have aesthetics. So we've got Botox, microneedling, weight loss, a lipo laser. And then we also have Dr. Brazier here, who does a lot of our spinal injections, and he's an anesthesiologist. And then something really cool, a stellate ganglion block, which is used to treat PTSD. So we've got a lot of different services just kind of geared at making people feel a whole lot better. Oh, and allergy.
and allergy treatments as well.
Yeah.
So the purpose of Discover Optimal is really that you want people overall to feel well, to feel healthy, to feel vibrant, right?
Yes, exactly. And to, in terms of a regenerative perspective, using the materials from your own body to heal itself and delay surgery. And in a lot of cases, we can do that.
Now, what do you feel, because you mentioned it a little bit earlier, what do you feel sets you apart?
A couple of things. The first thing, and this is kind of what struck me as one of the reasons why I wanted to work here, is that when you call Discover Optimal, you don't get routed through a call center. The people who pick up the phone are right here at the front desk, which is very different from almost any other healthcare facility. And we're, we know the names of our patients. We're a community. It's a culture. The patients aren't a dollar sign. I'm not trying to, meet a quota like some of the bigger healthcare facilities. And also what sets us apart is that we've got these innovative kind of procedures. Stem cell, for example, assists in cartilage regrowth. So for the purpose of regenerative medicine, they hold the most potential for healing and pain relief. They can actually help to rebuild cartilage and delay surgery that way. We offer PRP injections. So for those non-medical people who might be listening, PRP is a blood component. And so what we do is we take your blood, we spin out the platelet-rich plasma. We can actually inject that back into the damaged areas of the body to reduce inflammation, stimulate cell repair, and accelerate tissue and wound healing. We have Lipogens. Those are pretty unique. That's, made from the fat in the body. So similar to stem cell, but actually instead of coming from the bone marrow, it's coming from the fat. We have knee gel injections. So in order to delay surgery, we can actually inject hyaluronic acid into the knee space. And that can delay surgery for about 3 years in patients. And then the stellate block, that's kind of one of the most unique things that we have. I think between New York and Delaware, we're the only facility that provides that. And that's a local anesthetic that's injected into the stellate ganglion nerve bundle, which is in the neck. And it actually provides relief for symptoms like anxiety, insomnia, irritability, things that are, a result of PTSD. And it's really, really effective. It's amazing.
You mentioned a significant list of a lot of things that you help people with. And the list of things and what you mentioned, I thought, you said New York, and these are things that either I have heard of in the past that I thought, well, you can get these at big cities, or for some of these treatments, you have to go outside the United States for treatment. And this is in our own Delco. This is in Delaware County in our own backyard.
Yeah, it is. And it's, the coolest thing about it is we know that we're helping people. We're result driven and the patients keep coming back. So that's so special that, I come to work knowing that I'm actually going to help these people. They're agreeable to the plan of care and they come back because they know that they feel better. And that's kind of why I wanted to get into medicine and nursing to begin with, was to help people. And for the first time in a long time, I feel like I actually am.
A lot of these treatments, as I said, and what you said, these are cutting edge treatments. Talk about some of the things that you do day to day. So, how do you interact with the patients, or what are some of those things that you're responsible to do to help these patients get better?
Yeah, absolutely. So the patients come in, they usually meet with Dr. Jason first, just to kind of get an assessment and see what we can offer them. And then they come back to medical and I meet with them and I do a physical exam, take a history, and decide, what they would be, what would benefit, what would be therapeutic for them. And then when they come back, either I'm administering some of the injections, like the SI joint injection. We have a C-arm here, so that's done under X-ray. The knee injections, I do a lot of those, trigger point injections, and then, of course, the aesthetic stuff.
How did you get involved and get started with all this? This sounds so fascinating. Had this appealed to you, as being in healthcare, as being younger, as a kid? How did you find your way into all this fascinating medicine?
Well, I guess I've always really been interested in longevity and kind of natural ways to extend my own life. I'm really interested in supplements. Cancer prevention is a main one. And because I'm so interested in my own health, I read about this stuff all the time and listen to podcasts. And I felt a little pigeonholed in the past in a traditional internal medicine practice because, I wasn't able to really promote these kinds of techniques or therapies that I know are just as therapeutic, if not more therapeutic than some of the traditional stuff, like going to see an orthopedist and getting knee surgery. A lot of people would probably benefit from not having to go under anesthesia and have surgery. So, I just kind of stumbled upon Dr. Jason, and I really wanted to be a part of his team, and he hired me, thankfully.
So you talked about your interest in longevity, and obviously what's important is it's not just longevity, it's quality of life longevity, right? Mm-hmm. You want to have a vibrant life later in years. I'm going to put you on the spot and say, give us 3 tips, or what are your 3 tips that you have found, maybe that just come to your head, to extend your life, to have a quality, vibrant life? What are you doing? What are some of the routines and things you're doing?
Well, I suffer from chronic back pain. I've had back pain my whole life. And I would say the number one thing is adjustments from the chiropractor. That has changed my life dramatically since I started working here. And I certainly think that everyone could benefit from that. So I would start with that as kind of the base to building, a life that you're having less inflammation and you're more aligned. So you're not in as much discomfort. And then after that, nutrition, eating healthy, that's something we can go over here. But weight loss can help a lot of people with their knee pain, their back pain. If you take the pressure off the joints, then they're not going to hurt as much. And then, the supplements I think are pretty important as well. And
now you mentioned two things, obviously a chiropractor or a chiropractic approach. And you have, I heard you say at least one chiropractor on staff. So that's something that people can come to right away for you. You also mentioned diet, nutrition, weight loss. Is that something, you keyed on something very valuable, the weight and stress on joints. And if you can relieve, I don't know, you would be able to speak to this more so in a way, like how much pressure is relieved even by taking 1 pound off of, that joint or the movement of that area.
Oh yeah, it's significant. It's really significant, especially in the joints of the knees and the hips, which take most of the impact when we're walking. And then along with weight loss comes, kind of a shift away from that sedentary lifestyle, which will help, your cardiovascular health and everything that stems from that as well.
Yeah, I would think you come to discover Optimal, and yes, you can get the relief from these cutting edge treatments. But if you're not willing to, I believe, change some habits and rituals in your lifestyle, then it will only benefit you so far, correct?
Yeah, absolutely. But I've noticed that most of the patients that come here are really, they're on board with the plan of care. They're not coming here like you would come to your PCP because you have to, and then we're telling you, okay, you have to lose weight. Okay, you have to see an orthopedist. These patients are seeking us out because they're in pain. They've kind of tried everything else. They want a different approach, and their willingness to participate in the weight loss, in the exercise, in the injections, in, our therapeutic plan of care is just, it's really refreshing. And when they're willing to, to take the steps that are necessary, and I think that's the first part is the patient has to be excited and wanting to change something, or else, I can tell them, every visit that they need to lose weight and take their cholesterol medicine. But if they don't want to, then, that only goes so far.
They come with the right mindset. They come with the right attitude. They
Absolutely.
know it's going to be work. But here's what I hear a lot about what you're telling me and what you do, and the rest of the amazing staff at Discover Optimal does, is that you're changing lives in a manner that you're also changing the perception of what medicine may be or should be. It should be about just the direction and the focus on being healthy rather than treating symptoms or getting to a point where, hey, there are no other alternatives. Start now before you get to that point, right?
Exactly. Pain is so much easier to treat if we prevent it. And once you have the pain, that is a little bit more tricky.
Now, you mentioned, hey, you listen to podcasts and things like that. What motivates you, or who are some of your mentors in what you do? Who give you direction and who give you inspiration?
Oh, wow. I love Dr. Sinclair. I think he's fantastic. He's a pioneer in terms of the intermittent fasting approach and longevity. He talks a lot about NAD as a vitamin that's important for rejuvenation of the cells, and just kind of, his research in Italy. And if anyone is interested, I would Google Dr. David Sinclair.
We'll put him in the show notes too.
Yeah. But yeah, so he's kind of changed how I think about just my approach to not only what I'm eating, but when I'm eating.
What gets you out of bed every day? What motivates you?
Well, I think, I'm really excited to come to work these days because I know that I'm helping people. That is just kind of the coolest thing about my job. I love coming to work. And I don't know that many people can say that, but, and I hope I'm always able to say that, but yeah. And I work with a really phenomenal multidisciplinary team. I get to work alongside an anesthesiologist. Dr. Brazier is, extremely intelligent and very decorated doctor. And Dr. Jason, he's won the best of Delco since 2015. This is his brainchild, his business. He built it from the ground up. He's just unbelievably intelligent in terms of everything that he does. And he loves what he does. And I think that kind of permeates to the rest of the staff and just the excitement of being here.
Well, I have to ask, because you've lived, based on your education, you've lived quite a number of different places. Did you grow up in Delco?
No, actually, I grew up in Monco. And
okay. So you're not that far. You had heard of Delco growing up then, right?
I've heard of Delco, yeah.
Okay. So what is it about Delco for you? What appeals to you about that whole Delco spirit and that whole Delco thing?
So I love the down-to-earth feel of this community. I mean, these patients are so appreciative, and just even being around town, people seem really laid back and just really nice.
Okay. Well, I know that you mentioned that, all right, we're taking a healthy aspect or a healthy direction to life, but on those days where you may say, I really want a cheesesteak, where are you going?
Gyms.
100%. Okay. And how about for pizza?
Oh, pizza. You know what? I would have to say double-decker pizza right now.
Double-decker pizza right now. Okay. Now you have friends coming in from out of town, or you want to take them somewhere, you want to send them somewhere to have that Delco experience. Where are you sending them?
The Delco experience. So I would probably say they have to go to State Street. There's so many good restaurants there. I don't know if I can just pick one.
Well, you can do a whole day experience.
I would send them to State Street.
All right. I think they're coming to Discover Optimal to start. We're going to give them a whole, make sure that they're, pain-free, and they're able to just enjoy the rest of the day. If they need some treatments, some stem cell, right? You're taking care of them, right?
Yeah, absolutely. 100%.
Now,
and then they'll feel well enough to walk around Linvilla, maybe.
Oh, I love it. Walk around Linvilla, pick some apples, right? Go and get some baked goods and some pickles and things of that nature.
Yeah.
You need a convenience store. Where are you going? Wawa or Royal Farms?
Oh, Wawa for sure.
Right, Wawa for sure. Now, is there anything that we haven't talked on the podcast today that you want people to know about Discover Optimal, or you or some of the other doctors in the program?
I don't think so. No, I think you've been really, really thorough, and I don't know.
Okay. I've been good on my interrogation. That's been good. How do people find Discover Optimal?
Well, you can find us online, www.discoveroptimal.com. We also have 2 Instagrams. I have my own. And then there's also one for the business. So I'm never_age_NP. So never age NP, because we're trying to prevent aging. And then Discover Optimal, it's Discover_Optimal_health.
And is that on Facebook as well, or just Instagram?
Yep. We have Discover Optimal on Facebook as well. Mm-hmm.
Now, you mentioned the website. Now, where can people find your location? Where are you located at?
Yes, we are located at 3605 Edgemont Avenue in Brookhaven.
I think we're going to have a special segment and have you back on maybe monthly or so to talk about this whole never age thing. That's fascinating to me. And I think if we can help those in Delco to never age or age slowly or be vibrant when they're aging, they can continue to project that Delco attitude and experience to the world for generations. And we'll just conquer everybody. How's that?
Love that.
I love that. Laura, this has been wonderful. Thank you so much for your time today. Thanks for being a friend of Fermented Adventure. And look, if you are seriously listening to this and you're in the Delaware Valley region, you don't have to be in Delco to go there. I'm sure you treat patients from all over the area, don't you?
Oh, yeah.
Yeah. So if you're looking to live a vibrant life, I mean, we talked about that. Pain-free or manage your pain or work through some of those things physically that some other treatments or some other modalities have not been able to take care of. This is exactly where you want to be, and you want to reach out to these nice folks at Discover Optimal.
Yes. Thank you so much.
Thanks, Laura. All right. We'll see you on the next segment for Never Aging.
Okay. Done.
Thank you.